Good evening, and thank you so much for joining our first flu web. Oh no, actually this is our second. We did do one last night. Our flu webinar for 2025. So my name's Christina Mannion. I'm the Deputy Clinical Lead in Enfield and Barnet. So I'm based in North Central London. So Vaccination UK, we work in partnership with Public Health England and the NHS. And we deliver the school-aged immunisation services. And I'm very aware we have people from all over England on this call tonight. So please do use the chat box. The chat box is opened. Let us know what borough you're from, what school your child goes to. It's great for us to be able to kind of, know who's listening and who's jumped on. So just a few webinar tips. Oh, sorry. So just we've got everybody on mute at the moment, and just because when people join, they don't realise that there's lots of background noise, and it can be it can interfere with the webinar. Please do utilise the chat box for questions. I've got some colleagues on the call with me who will be kind of looking after that. There will be time for questions at the end of the webinar. But so if I'm on a slide and you think of a question, please ask it. No question's a silly question. If you're thinking it, somebody else is thinking it, and that is what tonight's all about. Okay, to be asking questions, and we can provide you with answers. I can't promise you I'm going to know the answer to everything, but I'll do my best, and if I don't, we will find out, and we will let you know the correct answer. We want this to be a very respectful, professional, and it's an educational space. Okay, so any inappropriate or disruptive comments, we will remove you from the session. Okay, the meeting is being recorded. Again, this is for further educational purposes. We're going to be sharing this because there's lots of people who've been unable to get onto the calls due to work commitments and timing not being convenient. So we will be sharing these webinars out to the schools for parents and carers to watch back. So this webinar is to help provide you with essential information to support you to make an informed choice surrounding consent for your child's flu vaccination. We're going to be looking at understanding what flu is, the impact of hospital admissions, why we vaccinate children, the types of vaccinations available, side effects, the safety and effectiveness, and we're going to be doing some Q's and A's as well. So I wanted to start with some statistics. Okay, so every year across the world, there's around 3 to 5 million cases of severe flu and up to 650,000 flu-related deaths. All right, in 2022/2023, the winter in England, there was over 15,000 flu-related deaths, and that's across all ages. Okay, 50,000 people were admitted to hospital, and 10,000 of these children were children admitted to hospital. Flu vaccines prevent millions of illnesses and GP visits and hospital visits every year. If you think, for example, during 2019-2020, the last flu before COVID, the flu program, so the flu vaccination prevented 7 million flu illnesses, and it prevented 7,000 deaths because of the flu vaccination program. This table here, these figures are based on children, so under 18s. So last year there was 53 deaths in children because of the flu, and this just, I wanted to share this because it shows the severity of the flu. Okay, particularly children, particularly those under 5 years and those with underlying health conditions, they're much more vulnerable to severe outcomes. In 2022/2023, there were 72 deaths in children. 2022 was a very bad year for flu. Okay, over 15,000 people died in the UK because of the flu. So seasonal influenza, so that's flu. Okay, we call this we call it flu for short. Okay, but it is influenza. It's an unpredictable, but it's a reoccurring pressure that the NHS faces every winter. Can I just check? So I think there's people waiting to be let in. I just want to make sure that everybody is jumping in. Everybody's had, yes, perfect. Sorry. So the flu is an acute viral infection, an infection of the respiratory tract. So it affects nose, mouth, throat, and lungs, and it's spread very easily between people. It's highly contagious, and it affects our airways. So it affects the way we breathe. Okay, it's very unpleasant, and it can lead to serious complications. Even if people have a mild or no symptoms, they can still spread the virus onto others. So flu season, we say it's between September and March, but the peak of flu is usually December and January. All right, that's when it's at its worst, and that's when people become seriously sick and the pressure in the hospital just becomes unmanageable. Flu is unpredictable and it's serious. It's not just a common cold. It can be life-threatening, as the figures I've just went over, you can see. So I'd love to know if anybody has had the flu. Because if anyone has had the flu, they understand how serious it can be. If anyone's looked after somebody with the flu, please feel free to share in the chat box, like how you experienced it, how you felt. I had the flu November 2023, first time having it, last time having it, but I'll never forget it. I'm very fit, I'm healthy, I never get sick. And I remember I was bedbound for a week. And I remember as the days went on, I was getting worse. And I just thought, oh my God, I remember thinking, if I was frail or if this was my parents now, they wouldn't even survive it. Like, that's how sick I was. And I am very fit. I don't have any underlying health conditions. I recovered a lot more quicker than other people around me what was having the flu that year. And I want you to, I've added this slide in because I need to differentiate flu from the common cold, because I've had people at work come to me to go, oh, no, I'm sick, I've got flu. And I think, well, you wouldn't be standing in front of me if you had flu. Okay, flu, you're going to be exhausted. You won't be able to carry out your normal daily activities. Your body's muscles will be aching, fever, God, no appetite. And it comes on really quickly, like within a matter of hours. And unfortunately, if someone has an underlying health condition and belongs to one of the high risk groups, they're going to have a much weaker immune system. They're going to have a reduced ability to cope with infections, which means they're going to be much at a higher risk of severe illnesses. So they're going to be developing complications such as pneumonia, bronchitis, worsening of their existing condition. It's going to take them a lot longer to recover, and it's going to increase their risk of admission to hospital. Whereas a cold, you're looking at a blocked nose, a runny nose, or a cough, a headache. You're generally able to carry out activities as normal. There's a big difference between a cold and flu, and natural immunity will not protect against the flu virus. So why does the flu have such an impact on people's health? So the flu can cause serious complications. It brings on other health conditions, and it makes existing health conditions worse. So those of underlying health conditions such as like respiratory disease, cardiac disease, or immunosuppressed, they're at a much greater risk of developing complications. If you've got mild flu, you might get an ear infection or a chest infection, but more serious complications such as bronchitis. So this causes your airways to be inflamed, and it's our airways that carry air in and out of our lungs. Okay, it usually takes a few weeks to resolve in a healthy person. So it's going to take much longer to recover in somebody who already has a health condition. Otitis media, some posh medical terminology for an ear infection. But if anyone has suffered an ear infection, it's so painful. And the flu will increase the risk of developing ear infection. And it's known as someone has had an ear infection once, they're much prone to getting them again and again. Pneumonia, all right, it's a serious lung infection. It's life-threatening. It can be life-threatening. On a healthy individual, pneumonia can resolve within 2 or 4 weeks. But in babies, older people, and those with respiratory or lung conditions, they're going to take much, much longer. They're at a much higher increase of becoming seriously ill and requiring hospital admission. Then you've got sepsis. Okay, it's life-threatening. It's the way our body responds to an infection, leading to organ failure and a dramatic drop in blood pressure. It's very serious. And those who are in a much higher risk of developing serious illnesses from flu are children under 6 months, are older people, those of underlying health conditions, so I've said respiratory disease, asthma, cardiac disease, long-term neurological conditions, diabetes, kidney disease, or those taking certain medication. Pregnant women, okay, infections while pregnant increases the risk of babies being premature or stillborn. Okay, the vaccine won't only protect the baby during pregnancy, it's also going to protect the baby in the first few months of life, as babies under 6 months are at a much higher risk group of complications from the flu. So how is the flu spread? Okay, so the flu is spread when somebody coughs or sneezes. Tiny droplets containing the virus are spread into the air, or they go onto surfaces, and it can be transmitted up to 1 meter. So anybody standing by can breathe in the virus, and if droplets fall on a surface and you physically touch somebody, that's how it's transmitted. Okay, adults can transmit the virus for 5 to 7 days after symptoms begin, whilst children, they can be infectious for 10 days or more, and they can even start to spread the virus before they become ill themselves. Okay, and remember, the virus can spread rapidly. So if you think of crowded places like schools, parties, weddings, public transport, that's why it's really important that we try and establish a herd immunity in communities to prevent the spread of the virus. So herd immunity it occurs when like a large percentage of the population is immune to specific diseases, meaning it can't spread, it cannot no longer spread from person to person. So herd immunity protects everybody, including the high-risk population. So I just put this image just for a bit of visualization. So the picture on top left, you can see lots of people without protection in blue. Okay, when someone gets the flu, it's going to spread very, very quickly onto other people. In the middle, a few people have been vaccinated, and you will see then few people are going to stay protected from the virus. In the bottom picture, you can see the majority of people are being vaccinated, which means they're even going to protect those who are unable to receive the vaccination and those who are most vulnerable. Okay, it stops the virus being able to spread onto other people. So here's a survey. It's from 2003. This was a survey from parents. Okay, it revealed that 2 out of 3 children do not wash their hands. Okay, 55% of children pick their nose, and 48% don't cover their mouth when they cough. And I'm sure so many of you can relate to this. I've got 3 children in primary school. My 10-year-old's much better than the other 2, but yeah, I'm constantly on their cases. Okay, and it just goes to show this is why the flu spreads very easily, and it's very contagious. So the flu program in schools. So what we do for the flu program consists of, we do the vaccinations from primary schools, so reception to year 6. From secondary schools, we do for year 7 to year 11, and we do our SEND schools. And we're actually able to give, within SEND schools, sometimes children are older than 18, and we can give the nasal vaccination up to the age of 25 in SEND schools. We commit, so at Vaccination UK, we commit to offer at 100%. So we make sure that all eligible children is equally given the opportunity to protect themselves from the flu. Okay, GPs do not routinely give the flu vaccination to children. Okay, they concentrate on older people, and they concentrate on those who are in clinically risk group. GPs are busy enough. Okay, that's why we have a school immunization service to provide the flu vaccinations in schools. So vaccination of children is based on the recommendation of the Joint Committee of Vaccination and Immunisation. So they're known as the JCVI. So they are an independent expert advisory group that they advise the government on vaccinations to protect public health and prevent illnesses. So that's why we vaccinate children. We know they play a key role in transmission of flu, and they are our biggest spreaders. And the aim of the childhood flu programme is to considerably lower the public health impact of flu by providing both direct protection to our children and lowering the flu transmission within the community for our more vulnerable population. Healthy children under 5 are more likely to be admitted to hospital with flu than any other age group, and they're 5 times more likely to be admitted than those over 65. Okay, children with long-term conditions are at increased risk of flu complications, and they are 5 times more likely to be admitted to hospital than those without underlying conditions. So every year the NHS experiences winter pressures. Okay, I've worked in the hospital for many years, the wards, there's the pressure for beds. We haven't got enough beds for the significant number of people being admitted and needing a hospital bed. Okay, and this is caused by the flu virus. Okay, and I've already discussed flu worsens underlying health conditions, and it brings on other health conditions. Each year, thousands of people are hospitalised. So many people go to A&E because they're worried about their health. I remember last year I had so many phone calls from friends worried about relatives and partners, and because they just were not getting better, and it was all flu related. And those in clinical risk groups are much more likely to have an admission to hospital. And I know so many people on this call will not have a child who's got an underlying health condition or be in a clinical risk group, but vaccinating your child will help reduce the spread of the virus. So it will help protect those who have got underlying health conditions, because the virus won't be able to spread as much. And we all know by the stats that I've already discussed that vaccinations can significantly reduce the risk of hospitalisation in children and vulnerable adults. So as I said, I know we've got people on from all over England on this call today, but I cover in NCL, so North Central London, and this is just some figures of the hospital admissions in children in NCL. So just last year there was 532 hospital admissions in those under the age of 18. Okay, us at the school immunisation services, we've got a duty of care to educate and protect as many children as we can to reduce hospital admissions. And the more people who receive the vaccine, the less the virus is going to spread, and protect our vulnerable older adults. And when I say older adults, like think of the grandparents, great grandparents, okay, they're precious. So we need to be thinking of them. And I've just added this one in as well. And this, again, this is from NCL, this is from North Central London. But as you can see here, the highest number of admissions in hospital were those aged between 1 and 4, followed by children aged 5 to 8, and then followed by our teenagers. So there's 3 types of influenza viruses, okay, which affects humans. You've got type A, B, and C. But type A and B, they're most responsible for most diseases. So the virus strain A is the strain that causes outbreak most years, and it's the cause of our epidemics and our pandemics, and it causes the most harm, human harm to humans. Our B viruses, they tend to cause less severe disease and smaller outbreaks, but the strain infection is more frequent in children and younger adults. And then you've got the C viruses. It's uncommon and it will only cause minor respiratory illness. And because they generally only cause mild infection, the C virus strains are not included in the current vaccine. So the current vaccine only contains both strains of A and B. It doesn't contain strain C, shall I say. So as well as strain A and B in the vaccines, there's no hidden ingredients. Every ingredient is listed openly in the patient information leaflet, which we will share in the chat box with you. And this is a legal document. Okay, it's approved by health regulators. Okay, nothing is hidden. Everything is available for you to look at. So parents often ask, why do we need the flu vaccine every year? The answer is because the flu viruses are always changing. Okay, last flu vaccination won't fully protect against this year's strains in the virus. So every year, the WHO, the World Health Organization, they recommend which strains should be used in the vaccine for the upcoming flu season. So this means your child and everybody who has the vaccinations needs to be vaccinated every year to protect them from the current strains, as the flu virus changes yearly. And our body's immune system, actually, the protection also fades over time. So a top-up's needed for best protection. And some people, such as older people or those with health conditions, their immune system doesn't respond as strongly to the vaccine. Another reason, guys, why we need, why it's important that everybody who can be vaccinated does, just to protect those most vulnerable, to help them who are not able to build up immunity to the virus like we are. So there's 2 types of flu vaccinations we offer in the school. So Fluenz, it's our live, or there's lots of different, we call it a live vaccine, nasal vaccine, LAIV, or Fluenz. I've kind of tried to just stick to nasal vaccine in this presentation. But it's the nasal vaccine, the Fluenz, is the only licensed in laser vaccination in the UK, and to protect children from the flu. And it's always our first choice for children. Okay, the nasal spray vaccination, it does contain live viruses that have been attenuated, which means it's been weakened, and it's cold adapted. It's a cold adapted virus, which means it cannot replicate at body temperature. Okay, so this means it cannot give anybody the disease, the illness, but it will stimulate the immune system to produce an antibody response, which will protect against flu. So if your child was to come into contact with somebody with the flu, the body's able to recognize it, the immune system responds, and it fights against it. Okay, it will, when someone has the flu vaccination, it takes 2 weeks to be effective. The nasal vaccination is given in the nose. Okay, it's painless, it's quick, it takes a second to do. And as I've already said, it's the most recommended vaccine for children. It's been shown to be more effective in children compared to the injectable. And that's because the vaccine is comprised of weakened whole live virus. So this means it replicates a natural infection, which induces a better immune response. And thereby it offers better long-term protection to children than the injectable one. The nasal, I've said we've used it from reception all the way up to year 11, and in SEND schools we offer it up to the age of 25. The nasal vaccination does contain a highly processed gelatine, therefore it may not be appropriate for your child, and if it's not, they can have the injectable. Okay, the injectable, the IM, this is an inactivated vaccine. So this means it's not a live vaccination, it mimics the virus. And this can be used in children when the nasal vaccination is not appropriate. The inactivated, so the injectable vaccine, we've been using this since the 1960s. So all of the inactivated flu vaccinations, they go in the deltoid muscle, they're intermuscular, so the top of the arm. And as I said, if your child's not suitable for the nasal, they can choose to have this injectable as well. We will share a video of the nasal vaccination being given so you can see how quick and easy it is. And if you have got someone, so I get a lot of calls from children if they've got sensory impairments, and some parents think, oh, I don't think my child would like to have this done in school. It's very normalised to have the vaccinations done in school because there's so many children having it done. The nurses are absolutely great to reassure, and where the other children can see other children having it done, and the majority of children laugh because it tickles a little bit, you can see it's normalised and it's not, it's actually, there's no need to be nervous, okay? So if you are somebody who thinks, oh, I wanted it done in the clinic, I'd always advise try having it done in the school, and if your child doesn't, then you can go along to a clinic. So the use of gelatine and vaccine. So the nasal spray vaccine, as I said, it does contain porcine gelatine derived from pigs. And this is a stabilizer to protect the temperature. And this is used globally against a wide range of medicines and other vaccines. It's a very highly purified form of gelatine too. The manufacturers of the nasal vaccine, Fluenz, they tested over 40 potential stabilizers, and gelatine was the chosen one because without it, the vaccine stability was significantly reduced. So there's no other nasal vaccination available that does not contain porcine gelatine. So members of the Muslim and Jewish religious communities, they may have been concerned about using vaccines that contain gelatine. Okay, so Rabbi Abraham Adler from the Kashrus and Medicines Information Services, he has said that it should be noted that according to Jewish laws, there is no problem with porcine or other animal-derived ingredients in non-oral products. Okay, so this includes vaccines, including those administered via the nose, injections, suppositories, creams, and ointments. However, it is acknowledged that some groups within the British Muslim community, they may opt for the injectable option, which is absolutely fine. And there is a website called the British Islamic Medical Association. It's a fantastic website. I'd highly recommend having a look on there. We're also going to share that with you in the chat box. And again, the decision is, of course, up to parents and carers. If they want to receive the injectable, it is on request, okay? So the impact of flu on family life, okay? So 75% of employees missed work when they had the flu or flu-like symptoms. And most employee adults who were caregivers for someone else who had flu, they also had to miss an average of 1 or 2 days. Overall, people who were vaccinated against the flu missed less time from work compared to those peers who were not vaccinated. And there was another study which showed that children showed a reduction in parental missed work by 90%, whereas compared to a placebo group. And there was also a 90% reduction in school absences in those who were vaccinated. So by vaccinating your child, you're not just protecting them, you're protecting your family's time, reducing stress and supporting your work and community. We all know what it's like to look after 6 children if we're in a working environment. It puts a lot of pressure on us. So eligibility groups. Okay, so protection from flu vaccines lasts much longer in children. Therefore, the priority is to start vaccinating all children, including those in clinical high-risk groups, from the 1st of September. And this is to provide early protection to children and reduce the transmission for the wider population. So children in clinical risk groups, so the immunisation teams going out in your area, we go to a significant number of schools every day in a short space of time. So sometimes within your school, we may have offered a date quite later in the flu season. If you've got a child in a clinical high risk group and you know that it's very important that they have their vaccination done earlier, please do let your vaccination team know. Okay, and this is something actually the GP will also offer for those in a clinical high risk group, because we know the importance of you vaccinating your child. But please get in touch with your team within Vaccination UK, because we have clinics available and we're able to invite your child along to a clinic if it's earlier, which will protect your child. Pregnant women. Okay, I know I touched on this. So pregnant women, NHS also start earlier within pregnancies due to them being at a much higher risk group of complications during pregnancy, which I have already discussed. So from October, okay, based on the evidence that flu vaccines effectiveness can wane over time in adults, the JCVI, so the Joint Committee on Vaccinations and Immunisations, for most adults, it's the beginning of October. And this was due to the understanding that the majority of vaccinations will be completed by the end of November, close to the time when the flu season commonly peaks. Okay, and make sure everyone's vaccinated before that peak. So side effects. So every vaccination, every medicine can come with side effects. The flu vaccination will usually disappear within 1 or 2 days. Okay, it's temporary. For the nasal spray, you might have a runny nose, might be feeling a little bit more tired or unwell, decreased appetite. Or what I would say, you've got to remember that our bodies are amazing. So while our bodies are building up antibodies to protect us, it has to work that little bit harder. Okay, so you may be feeling a little bit more tired than usual. Okay, just remember this is temporary. It's not going to last more than 1 or 2 days. For the injection, most common side effect would be redness, a bit of pain or site of injection, may develop a fever. But again, you've just got to weigh up the benefits of preventing flu, preventing hospitalisation, preventing complications. They far outweigh the small risk of a runny nose for a day or so. Remember, there's a big difference between flu and cold. Now, all my children have the flu vaccine every year, and they've never experienced side effects. So you're not, just because I'm saying there is side effects, not every child does get a runny nose or a fever after. So reporting side effects, okay, there is a yellow card scheme and it's run by Medicines and Healthcare Products Regulatory Agency, so the MHRA, which some of you may be familiar with. So what they do, they safeguard medicines, vaccines, medical devices, blood products, e-cigarettes. Okay, they measure the quality and efficiency in the UK. Anybody can report on the yellow card system. Okay, this is closely monitored information. They monitor the safety of every vaccine, of every medication. Okay, so anybody can use this to report any side effects, and this is how we monitor and make sure that everything is safe, which we are using. And on my next slide, I'm rushing here, going on to my next slide. So how safe is the flu vaccination? So all vaccines go through a regularity approval process, okay, to ensure they meet strict safety and effectiveness checks. The children's flu vaccine has an excellent safety profile. Okay, it's been used since the 1960s, and the children's flu program has been used in the UK since 2013. Okay, the nasal vaccination, it's not licensed for children under 2 years of age. Okay, because studies have shown that under 2 years they're at more increased risk of hospitalisation and wheezing in the 6 weeks post-vaccination. So that's why we don't give the nasal vaccination to under 2s. Okay, they're given it inactivated, the injectable. The LAIV, so our nasal vaccine, has been used in the UK for the past 12 flu programs. So we've given safely over 34 million vaccinations, flu vaccination, nasal vaccination successfully with no adverse side effects. It's a very, very safe vaccination. So what's the process for our consent? So we rely heavily on our schools, okay, to send you guys out all the information in the schools. So this will include an e-consent, which means we have the consent form filled out. We will not give a vaccination without a consent form filled out to say yes. Okay, what you need to remember is that we give 100%. We want to show that we've given everybody 100% to commit to doing the vaccination. So even if you wanted to opt out of your child having the vaccination, we still need to have the form completed to say no. Okay, this just goes to show that you've been given that informed choice to make that decision. Because if we have anybody who's not responded, we then need to make sure, we then need to try and call you to make sure, is there a reason that have you not received this information? Because we have a duty of care to make sure you have been informed about the vaccination. If you have any further questions about the vaccination or your child, make sure you call your Vaccination UK team in your borough. Every borough's got their own team, and we're here to help. We will share details at the end for who you need to contact. So just some contraindications or precautions to be aware of. Okay, there's a very few individuals who cannot receive any flu vaccination at all. And there are some individuals who cannot receive the nasal vaccination. They may need to have the injectable instead. So asthma. So if your child's got asthma, okay, the JCVI advised that children with asthma on inhaled corticosteroids, they can safely be given the nasal vaccination, okay? However, the nasal vaccination is not recommended in children who are currently experiencing an acute exacerbation of their symptoms. So if they've got an increased wheeze, or they've had to increase their dose of their bronchodilators, so their inhalers, in the last 72 hours, we wouldn't give them the nasal vaccination. Okay, they will be offered the injectable, but we wouldn't give the injectable without speaking to whoever's filled a consent form out. And as soon as you tick that your child's got asthma, the nurses on the session will assess your child. They will assess their asthma. They will be asking them questions, making sure that they understand if they've had any wheeze, have they had increased use of inhalers. If they need to call you, they will. Okay. If your child is severely immunocompromised, okay, what I mean by severely immunocompromised is if your child is receiving chemotherapy. Has your child got leukemia, lymphoma? Are they on a high dosages of immunosuppressants? Okay, they will not be suitable for the nasal vaccination. They will be eligible for the injectable. Okay, that's what I mean by immunocompromised. And also, if somebody in the household is also in isolation because they're severely immunocompromised, sorry. So somebody's had in isolation, they've had a bone marrow. Okay, we would also recommend that the child is given the inactivated, so the injectable vaccine. Okay, for those children who are using topical corticosteroids, so like creams, ointments, ear drops or eye drops for treatments such as eczema or psoriasis, they can absolutely receive the nasal vaccine. Okay, they are not severely immunosuppressed. They can receive the nasal vaccine. Minor illnesses. Okay, minor illnesses without fever are not a valid reason to postpone the vaccination. So if your child's got a cold, they're absolutely fine to have a nasal vaccination. If they're acutely unwell and they've got a fever and they're present, we will postpone that vaccination. Okay, and this is just to avoid any confusion which will wrongly attribute to any signs or symptoms to adverse reactions of the vaccine. So we don't want to get confused of what's causing this. Egg allergies. So we've had a lot of questions about this. So with egg allergies, it can be safely given. The nasal vaccination can be safely given to those with egg allergies. The only exception is if your child has previously had an anaphylaxis reaction and needed to go to intensive care because of their egg allergy. Okay, the reason that we can safely give the nasal vaccination to those with an egg allergy is because the trace of egg albumin, the content is under 0.024 micrograms per 0.2 mils in a dose. Okay, it's considered very safe for children with an egg allergy to receive the nasal vaccination. If you do have a child who had a serious anaphylactic to eggs and needed intensive care, we will recommend that you have the nasal vaccination in a hospital setting. Okay. Solicitate therapy. So if your child is on aspirin therapy, we will not advise to give the nasal vaccination. There's an association with Ray's syndrome, so we will offer the IM vaccination. If your child has had an anaphylactic reaction to a flu vaccine in the past, for a nasal, we would advise you to have the injectable. And if there's any anaphylactic reactions to any components in the vaccine other than egg, we wouldn't advise to have the nasal vaccine. So just some key notes to take home. So we're coming to the end of this. So I hope when I come off here, there'll be lots of questions. So the flu can be very unpleasant illness, okay, causing fever, extreme tiredness, muscle aches, and complications of flu include acute bronchitis, ear infections, pneumonia, and sepsis. Okay, it can be very serious, especially for children with medical conditions. Okay, children under 5 have the highest rate of hospital admissions due to flu. Okay, just remember the nasal vaccination, it's painless, it's easy, and it's the most effective in children. We've given millions of children worldwide the flu vaccination, and it's got an excellent safety record. If your child does get the flu, you may have to take time off work to look after them. Okay, getting vaccinated against flu can help protect you, your children, and your family. Everybody is susceptible of flu. Okay, even if you've got a great immune system, you're never sick, you're still nothing. Your natural immune system will not protect you. You can be infected with the virus and have no symptoms, and you can still pass that virus on to others. Okay, good infection control measures reduce the spread. So just think of your hand washing. The impact of flu on frail and vulnerable patients and people can be fatal. Okay, and outbreaks can cause serious disruptions in the community. Just remember that the flu vaccine has a excellent safety record and will protect you, and it cannot give you the flu. It can only protect you. So there's lots of further reasons. So as I said, we're going to be sharing lots of links with you if you do want to know more and do some further research yourself. We have come to the end, so we will go to some Q&A, so some questions. There is a feedback form, so please fill the feedback form out. This is just so we can improve on our webinars. We know where we've done well, where we might not have done some well. If we've missed anything, we know to cover it in our next one. So please do use the feedback form. Hopefully my colleagues sharing it in the chat box. And I hope you've all found this helpful, and you're able to make that informed choice of your child to receive the vaccination. You can also scan this. If you're watching this on a laptop, you can scan that QR code. So I'm going to stop sharing and we'll go to some questions, if that's okay.
Christina, so we've had some questions just in the chat box.
Yeah.
So one of the questions was, what if you've come in from another country, and this is not necessarily just for flu, but you don't know your vaccination schedule? Where can you find out about what vaccinations we give in the UK?
So I can provide that to you. They've actually been updated. So if you feel like your child is missing any vaccines, we can have you got a health record book. Have a look in there, but we can provide you with that information. If you do, have we got this person and individual's details, and we can get back to her and share that with her or them?
Yeah, absolutely. Yeah, it's within the chat, so we'll be able to send that on.
Yeah, absolutely. If you feel like, and this is not, so the flu vaccine, I said it's yearly, but if you feel like your child is missing any other vaccinations, we can make sure that you get up to date with them.
And then one of the other questions was about allowing to have their child the vaccine in school, but how is it important for adults and parents to get their vaccine as well?
Sorry, can you just repeat that?
Yeah, so somebody's just put in the chat box about they don't typically have the flu injection, but they're going to go ahead and have the vaccination for their child in school this year. How important is it that their parents also have the vaccination?
So as I said, herd immunity, the more people that have the flu vaccination, the better. Just think, so I've got 3 close people now under who are immunosuppressed and having chemotherapy. It's just a peace of mind knowing that I'm going to be vaccinated to protect myself from flu. My children are. I'm not putting anyone else at risk. Okay, you don't know who is around you, what friends you have who are immunosuppressed or who can be more vulnerable. So if you're vaccinated, if you're protected, you won't be spreading that virus on. And I know, so the flu vaccination, it's free within the schools, but if you're not in a clinical risk group, you do have to go. You can get it done in pharmacies, there is a price. It's not too much, actually. I don't actually know how much it is. I think it's maybe like £20 or so. I must check that out. But if you're not in a clinical risk group, you won't be offered it routinely at your GP, but you still can go to a pharmacy and get it done to be protected yourself. And you'll just be preventing the transmission of the viruses onto other people. I hope that helps.
And so another question we've had is that the nurses have already visited their child's school and they didn't consent for the vaccine at the time. Obviously, with all your knowledge that you've given today, they may want to now go and have their child vaccinated. Do we go back into schools and do we have clinics?
So yeah, we have clinics. So we have clinics. We do clinics on the weekends. We have clinics in our holidays. So a lot of the schools, it depends on the cohort. So in London, we've got really big cohorts. So most of our schools do have like a 2 sessions. So I would get in touch with your team within your local area. We can change the consent and they'll let you know if their clinic dates available and you can pop along to one of the clinics. But it might be that your school has got a second session. So get in touch with your local area. The team will be more than happy to help you and signpost you whether they're going back in the school or you can go to a clinic.
Excellent. So I think that's all the questions, Christina, from the chat box. I don't know if anybody's got anything that they want to ask. Okay, so we've got another one come through. So we opt for the injection, but since the son is scared of the injection, they're not sure about how nurses will manage that fear. Could they come to clinic for that instead?
Yeah, if you feel like your child is going to respond better with you there, absolutely. But what I will say is we have to give a number of injectable to children in reception, and that, you know, it's normalized when there's a lot of children in a classroom having it done. And the nurses are great. All right, they see nervous children all the time. So we don't just do the flu program, we do a number of school immunizations throughout the school. So we give a lot of injections. So I would say trial your child in school first. Nobody's going to force your child to have it done. If they're frightened, they're nervous, anxious, we will just say child refuse, and then we can invite you along to a clinic. So it might just save you a bit of time rather than booking straight into a clinic. See what we can do first, and then if we're not unsuccessful, we can invite you along to a clinic. Just saves you having to go to a clinic. But yeah, the majority of children, when everybody's around and they're with all their friends, it's normalized, it's okay. So I think a lot of parents are very surprised and how well their children receive it in school.
Excellent. And then we've actually got a hand up in the group. Rumaina Hussain.
Yeah, let me see if I can unmute you. I'm a nurse. I'm not very good at technology. Allow mic. There we go. Oh, have I unmuted you?
Hello.
Oh, perfect. Hello. Great. I've done it.
Okay. Actually, I have a question. We are planning to visit Saudi Arabia, and our flying agent, they told they already had the vaccination in school.
So is that for the meningitis?
Yeah. So
yes.
How I will get the certificate? We need the certificate.
Oh, so your child's already had the vaccination for the meningitis because you do.
They are in year 11.
Yeah. So if you get in touch with your local borough for the school your child goes to, get in touch with the team. and they'll hopefully be able to provide you. When a child is vaccinated in school, we do send all the information to your GP as well.
Already they had, and the next one already they booked for the next vaccination. But we went to school sent to GP, and GP sent to school. So
Yeah,
actually we don't know from who we can get the certificate.
Okay, contact your vaccination. You can contact your team, with Vaccination UK within your local borough. They'll be able to help you.
Yeah, in Redbridge Borough, who I will contact?
Redbridge. So if you, I will put in the email address in the chat box, and then you can email them. And I've just popped that in there in the chat box. So email Redbridge. I don't know the number off the top of my head, but give them a call and they'll be able to help you.
Okay, thank you.
You're more than welcome. Anybody else?
So we've got another question, Christina. Is there any side effects if a child has been given the vaccine twice, 4 weeks apart?
No, there isn't. There is no, it doesn't give any extra protection, and it doesn't give any worsening side effects. It causes no harm to have the vaccination twice. Obviously, there's no need for it because it's not going to give a better protection, but there is no harm done whatsoever if a child has to receive the vaccination twice.
And does the flu vaccine have long-term effects, Christina?
No. It has an excellent safety profile. If there was going to be a side effect, it would happen only for 1 or 2 days. There is no long-term effects from having a flu vaccination. It's very, very safe.
And then we've got somebody who's put in the chat that their child has a health condition. How would they find out if their child was suitable to have the vaccine or not?
So as I said, so it's very limited. So it's such a safe vaccination. It would be over if they're severely immunosuppressed, if they've had an anaphylactic reaction, severe anaphylactic reaction to egg and needed intensive care, if they've got a acute exacerbation of a wheeze for their asthma. There's not many people who cannot receive the vaccination, but always we're a team of nurses, experienced nurses. So please, if you have any concerns, give us a call, because there's so many health conditions out there. We can look into it and we can reassure you, and we'll give you any information we have on that to give you some reassurance about the vaccination.
So the next question is, can we have a little bit of a recommendation for a child with a very severe egg allergy? We haven't vaccinated him at all yet. He's almost 8, but worried about a potential reaction. He also has autism, so would rather not have the injection. Can we safely avoid giving the injection and safely give the nasal vaccine?
Yes, so it's very safe. I was actually on the website today and my mind's gone blank. I will share with you the allergy government website. They have absolutely recommended that it's safe to have the nasal vaccination, even if you are allergic to eggs. It is so low. The trace is near enough even untraceable. It's so low, so it will not cause harm. So it's been given the go ahead to give the children, even if they've got an egg allergy, it can safely be given. So that is my reassurance, and I will share with you actually something in the chat box.
I've just popped it in there for you.
Oh,
Christina.
perfect. So have a look at that in regards to the egg allergy, and there's lots of information about it. So if there's anything, please come back and let us know.
Next question. I am going through chemo treatment at the moment and don't know if it's safe for my children to take the vaccine since my immune system is low. Infection from them would be hard for me. What would we recommend?
I would recommend, because they'll be in close contact with you and you are severely immunocompromised at the moment, I would recommend that your child has the injectable. And it's really important that your child is protected from the flu to protect you. But I would advise your child to have the injectable, not the nasal. They're going to be in close contact with you, but do make sure your child has had the vaccination, because they're in school and then they're coming home, and that's how the virus is transmitted. So I would definitely advise. So if your child really didn't want to have the injectable, we would say leave it for 2 weeks for coming into close contact with you. And I know that can be really hard with your child. So we would advise to have the injectable. But if your child is adamant they didn't want the injection, they wanted the nasal, we'd recommend that they wasn't in close contact with you for 2 weeks.
Just to add to that as well, yeah, we'd also recommend that you had your vaccine, your flu vaccine, to be protected. So next question, is the flu vaccine mandatory for children in school?
No, absolutely not. Everybody has a choice, and that's what this webinar is about, to make sure you've been given informed information so you can make an informed choice if you opt in or opt out for your child to have the vaccine. But what I will say is, even if you were to opt out and you didn't want to protect your child from flu, the consent form still needs to be completed. We still need to make sure that we've had the response from you.
And then I think it's just another question about that the nurses have already been into school, and either you have put your consent in or haven't put your consent in, but either way the child hasn't been seen. What happens in that scenario, just to reiterate?
Okay, so if you've filled out a form and you've said no, okay, and we've already been into your school, there is clinics available, catch-up clinics, where you can call us and we can amend your consent form for you over the phone with you. And then you can come to a clinic. It may be that there's still a day we're due to come into your school, because we've only just started to go into the schools. It's only been like this week, last week, where we started to roll out the programme. So there's a number of schools we've not even been into yet, and the second session probably hasn't been done if your school does have a second session. So there is, if you've already filled your consent form out and you've said no, and you've been on this webinar tonight, and after the information you've changed your mind, just call your borough, just call your local borough of Vaccination UK, and they will be able to change that for you.
The next question is, if an individual has asthma, which vaccine do we recommend?
So the nasal. So the nasal is always our first choice, unless there is a reason why they cannot receive the nasal vaccination. And for asthma, it's really important that that's a high risk group. Okay, it's gonna, if someone with asthma catches flu, they go straight on their chest. Okay, they're at a much more higher risk of complications associated with the flu. So it's really important that they are protected, and we would recommend the nasal unless they had an exacerbation of their asthma. On the day we were going to vaccinate, if they had an exacerbation of their asthma in the last 72 hours, we wouldn't give the nasal. Okay, but if they're absolutely fine, they're taking their inhalers as they regularly do, we would absolutely advise to take the nasal vaccination.
Excellent. So we've just got 5 minutes left, so we'll just go to the last couple of questions. So there was a question just from the start, and I think they might have missed the answer. So I have a question from South Woodford. We've recently come into London, and he's had his vaccinations in India. How do they find out where what vaccinations they need regarding the UK schedule? So I think we said we were going to send that information to you directly.
I'll send out the UK immunisation programme schedule. Depends on the ages as well. So we do, children should be vaccinated with both doses of MMR, the measles, mumps and rubella. We do our flu vaccination every year. The reason we give it yearly is because the virus changes every year. So the vaccination has to be changed to match the strains of the virus, to make sure that we are given protection. So we're building up the right antibodies to each virus. In secondary schools, in year 8, we delivered a HPV vaccination. This is the human papillomavirus. Okay, it's the human papillomavirus that causes different types of cancers, cervical cancer, cancers of the mouth, throat, and it affects boys and girls. It's a very common virus. It affects 4 out of 5 of us. Okay, and this HPV vaccination is given to year 8 students. Some countries, they give it at the age of year 9. In the UK, we give it to year 8 students. And then in children in year 9 in secondary school, we give the meningitis. It protects strains of meningitis A, C, W, and Y. Meningitis causes inflammation of the brain and septicemia. And we also offer in year 9 diphtheria, tetanus, and polio. It's called a 3-in-1 teenager booster vaccination. The reason we call it a booster is because your child's already had this 4 times as a baby. So in the red book in the UK, our health record book, as a baby, they're given DTP, diphtheria, tetanus, polio 4 times. The one in secondary school in year 9 is that dose to protect against through adulthood. And these are the vaccinations which are due in secondary school. But we will share this with you in the chat box as well, the school-aged immunisation schedule.
So Liz has asked, we have a newborn at home, which vaccine is recommended for my 6-year-old?
So the nasal vaccination would be recommended for your 6-year-old. Babies under 6 months are not vaccinated. So we really rely heavily to protect your baby, that everybody in your family household is protected from the flu. So you all receive your vaccinations, and congratulations.
There's a question about there's that lots of people might not trust the flu vaccination, especially after things that they've heard about COVID-19 vaccine. How can we get parents to trust the vaccine again, please? And I would just like to say we would hope with webinars like this that Christina's delivering, that hopefully we are building a little bit more trust in these vaccines again. Yeah,
and reliable resources, and we can see that the flu vaccination program has been going since 1960. In children, we've been doing it since 2013 in the UK. In the USA, it's since 2003. It's safe. It's an excellent safety profile. We've already seen the figures and the stats, how much it's reduced hospital admissions, how much it's reduced deaths. And we know, so those who have anyone sick in hospital, and they're waiting for beds, like the pressure on beds in hospitals, it's just, this is a public health intervention. These public health interventions are done to protect us, to prevent illnesses, to reduce deaths. And this is why we have vaccination programs, because that is what vaccinations do. They stop the spread of diseases, they protect us.
Excellent. And then just last question was, the child has had the vaccine last year for the 24-25 season, but they didn't have it until March 2025 this year. Can they still have the flu vaccine for the 25-26 season?
They can, because as I've said, the vaccination, it's the strains of the vaccination, the way it's made, it's changed yearly to make sure it protects against the current strains going by. So the strains change every year, so the vaccine has to change to match the current strains of the vaccine. So last year's vaccination would have protected against last year's viruses, so them strains. This year there's different strains circulating, and the vaccination has been made to protect from the current strains circulating.
And we have just had one last question come in, so
one last
one, but we'll just squeeze it in before we finish. Which vaccination seems to have less side effects? Is it the injectable one or the nasal one?
So they're both the same kind of side effects, apart from everybody's different. Everybody's body responds differently as well. So there's no difference. An injection, it may be a bit more painful to have an injection than a little squirt in the nose. But in regards to the way your body responds, so many people don't get any side effects at all. Some people may get a headache, some may get a runny nose. You can't clarify that as a straight answer, because we just all respond differently. All of our bodies, our immune system work differently. But all you need to know is that there's no serious side effects, and they're temporary. And if you were to get a side effect, it far outweighs actually what you would be getting from the flu, unfortunately. And I'd just like to say thank you so much for everybody for joining the flu webinar today. I hope you found it helpful. Please do fill out the Please do fill out the feedback form. This is actually our first time doing the flu webinar for the schools this year, so it's really important that we do know, did you find it helpful? Is there anything else you would have liked to have seen in here? But you've all been great. Thank you so much for being engaging in the chat box. It's really good to see some really valid questions being asked, and so it's great. Thank you so much. Thank you, everybody.
Thank you, Christina. Bye.
Thank you so much. Have a lovely evening, everybody. Take care.